This is Semaj. He currently got us doing a walking sick clinic over at Temple. Oh, so now day 2, Semaj got us at the doctor's because he refused to pop his leg back in order. Let's see how this journey goes. Say hi, Semaj.
Hello. Hey.
Say hi to your YouTube friends.
Hey.
So let's see how this goes. Semaj, put your legs straight.
Oh, I can't. I really can't. That's where it started. So one thing is that pressure is really far on the side. That means you're going to be pressing more through that leg than you want to. These crutches need to stay close, but not too close, right? It's that in between. So forward with the crutches.
Keep your leg the whole time.
Remember, we need to give space for both legs, alright? So you might feel like I want to get my foot right in the middle of those crutches, but we need to give room on both sides. Alright, we're going to turn around and take a seat for a second. That is okay, but I want you to remember that as you continue moving, okay? Because when we are here on our toe, that is not a good position for us to use these quads on the front, alright? The straighter our leg is, the easier it is. I think, like I said, when you're in the knee brace, it's going to be very different. You're going to feel more confident to do some of these skills. But I need to make sure that you're safe going home today, to get into your house, to walk in school. So I need to at least to make sure that you're able to do this safely. All right? Does that make sense? Right.
Good. I got it.
Sorry. All right. So we have stairs on the left on the right,
Yeah.
which is frustrating, but you'll do this in no time. All right, so I want you to walk up closer, and I want you to give me one of your crutches because I'm going to show you first. All right, you all right? Here, let's take a seat just so you have something to take a break for. All right.
So this is the 3rd building Semaj has me in. So let's see what they say.
Pull out the pop. So the pop like a couple times.
Okay. Nice and relaxed. I'm just going to test a few things.
Relax more.
I know it's kind of hard. You're keeping your knee bent. Okay. Any pain up here? Are you able to straighten your leg out to kick my hand? And bring it up and hold it. And don't let me push. And push down on my hand. Okay. So most of your pain's right in here. Yeah, okay. Let's take the wheelchair, let's go over to x-ray, let's get some pictures of the knee. Afterwards we'll come back to this room. And then we can talk some more.
This is nice up here. So nice. This is their physical therapy floor. Buster. So now you're going to extra.
Alright, so straight over to that yellow hallway and follow the sign. Give me a test up and down, okay?
Okay.
word you refer to it as, your tibia, and then your fibula here. So first things first, just looking at the integrity of the bone, really nice and solid all the way around. I'm not seeing any cracks or breaks or fractures through the bone. That all looks really nice and healthy. When you turn to the front, now we can see again, femur, tibia, fibula, integrity of the bone, all looks great. The alignment of your joint, nice and spaced out. And then when we turn you again one more time, here's your patella here, or your kneecap, sitting right in this groove here. So if it was displaced, it'd be way out to the side here or off to the side. So at this single point in time on your x-ray, we know it's in place. But what it sounds like is happening is you keep having these recurrent patellar subluxation events. It sounds like the last one you had really did you in. There's a specific ligament right on the inside of your knee here called the MPFL, or the medial patellofemoral ligament. That can commonly tear or rupture, sprain, things like that. So what we'll want to do is today we'll get you you sounds like you have a knee brace, but we can just get you a new one. I don't know which one it is. A patellar stabilizing knee brace. We're also going to get you some crutches to keep the weight off it, let everything kind of cool down. And then what we'll also do is put an order in for an MRI, which is going to show us more of the soft tissue, the ligaments, the cartilage, to see, did you tear something? What exactly is going on in the knee that you keep having these events? And where do we go moving forward?
Who we see last week, my dad?
James.
No.
Ortho.
Yeah, ortho. They said I got my knees is like hyperextended. I know they said that. I really forgot what they said.
A lot of
They
times
were saying a lot about this. It was like, this is cool, that's aligned up.
Yeah.
And everything. I kind of forgot this.
Usually first line treatment for this is strengthening up the muscles in your quads that hold your patella in place there. But if you keep having...
My hamstring is real tight.
Yeah.
That's good. It's alright since I'm young.
Stretching out the hamstrings can also help. But if you keep having these events and you're not able to put weight on it, that means there's probably something a little bit more going on than meets the surface with an x-ray that would warrant more evaluation. Especially your range of motion too. If you can't get your knee completely straight, that's a little more concerning too. If you had full range of motion, you weren't having any pain, I would say, hey, maybe this is something we could do with physical therapy and really kind of get you back on track. But you've already been doing the therapy, you've already been strengthening. This seems like it's more of a setback than what we would expect. All right.
Okay.
Questions? So no basketball for now, and just really kind of taking it easy, using the crutches, keep the weight off it, position of most comfort when you're sitting or sleeping, nothing,
I can
too crazy.
keep on the weightlifting.
Okay, no. Yeah, not until we get some more information. I don't want you doing more damage to your knee. So I want things to kind of cool down. Things like Tylenol, Motrin, just look at the dosing on the bottle. That can help with the pain. And really just kind of taking it easy until we can get that advanced image.
Okay.
All right. Some things you could do, just like sitting in a chair. I'm sure you can do like upper extremity stuff, but I really don't want you doing a whole lot to make your knee worse. All right. Other questions? All right. Let me put all those orders in. So what we'll do is we'll send you over to our brace shop, which